ஃப்ரெண்ட்ஸ் நாங்கள் இன்னைக்கு இல்லை டிபார்ட்மெண்ட்டுக்கு போகிறோம்.
Do like and support Mr. Syed Khan.
In hospital, only treatment in which type? Inpatient, yes, inpatient type. What is inpatient? Yes. What is outpatient? What is inpatient? Which difference between inpatient? No, I'm asking that.
Inpatient means it should be there. They no need every time. Yeah. Opposite.
Good morning. Inpatient?
Every time monitoring.
Yeah, inpatient every time, 24 hours should be monitoring. Outpatient, only once, checking once. And outpatient, example for outpatient, for the clinic, rural medical center, what else? Ambulance station, and unit. What is unit, medical unit? What is unit? Medical unit. Who can explain? No one remember. Yeah, I will explain. Mark. What is unit? Unit is cabinet. Let's say cabinet in hospital. No, where? No.
Hospital.
In industry, the unit of industry, and this function of this unit only for employees. Treatment and take medical care only for employees of this industry. Understand? It's a medical unit for employees. Okay? Okay. And hospital. Which difference between hospital and the clinic?
First aid.
In hospital, only medical care, treatment. In clinic, medical care, treatment, education of students, doctors, nurse education, and researching works. And this is clinic. Okay? And here you are studying. There in department patient treating, and parallelly we are doing researching examination. Understand? What is clinic? What is hospital? Okay. Each hospital, clinic also should contain of 3 parts. Yes? Which parts? You are flying? Parts? Admission department, treatment departments, many departments, and
Medicine.
Diagnostic department, and administrative and financial department. Understand? Each hospital should contain of admission department, treatment departments. It is surgical department, it is therapeutical department, it is diagnostical departments can be, it is neurology, neurosurgery, ophthalmology, cardiology, or departments. Okay? And administrative and financial departments. And now I will explain you a little bit about some function. And in our clinic also we have here maternity center, childhood center here, and there is a place for education for students. Yes, everywhere, everywhere. It's a educational and
Video.
okay. And then here in our clinic also we have here kitchen. Today's our topic is feeding, yes?
Feeding.
Diet tables, feeding of the patient. And I will explain you a little bit. First day when patient came, doctor checked him, yes, in where? In admission department. First he come to the admission department. In admission department, doctor in duty, check patient, diagnose him. And what else happens in admission department besides checking? In admission department. What else happens in admission department? Function of admission department. Checking. How we name it?
Anthropometry.
What else? And
BP pressure, blood pressure,
okay, it's an anthropometry.
To measure blood pressure.
It's a checking. All is checking. What else? Checking. Anthropometry. What else? Checking.
Determining the department of the patient.
Yes. Determining the department of the department and transportation to the department. And what else?
doing the medicine.
Sanitary treatment. Sanitary and hygienic treatment. Sanitary. And which parts of the sanitary and hygienic treatment should be done?
Hands, nails.
No. First come, you will cut the nail, yes?
No,
First
hand
you should do what?
sanitizer.
Guys. You need sanitary part? No. First, examination. Examination of skin and hair. Skin, nail, it is skin. It's a continuum of the skin, yes? Hair. Examination of the skin and hair. First, examination. Second, cutting of nails and hair. And next is? Showering and bathing. Yes, it's a function of admission department. I have a question for you. If patient in serious condition, how will you do showering? Patient is not able to stand or to sit. She will not, if in serious condition, patient will not take shower. Not take shower. How we can clean clothes? Yes, with help of the clothes. Nurse will assist them. Yes, and will assist and clean. Just without bathing, without showering. Understand? Okay, function of the admission department again. Yes, function of admission department. Just now we talked about it. Function of admission department. Registration, what else? Examination, hygiene, anthropometry, and transporting to the department. Okay, transporting department. With medical transportation, to the department's wheelchair, stretcher, or by hand. Yes. Okay, and now understand about the admission department. Okay, function is registration, checking, cleaning, transportation to the department, and anthropometry. Okay, in each department should contain therapeutic department. Now we will talk about therapeutic department. Structure of the therapeutic department. Main why? And kitchen. For kitchen. Yes. Now, patient when transported to the department, to the therapeutic department, there will treat him another doctor. He is a treatment doctor. Okay. He will prescribe him diet number by his general condition. Okay. Diet number. And diet number, what happens with this diet number? And nurse in duty will see diet number and will write check list of the diet numbers with names to the kitchen, to the chief, to the chef, master chef. He will make diet. Yeah. According to this, he will make food every day, and we have a staff. Which? Not nurse. will busy only with feeding, and he make chief will make food for that. For example, for each patient another food, okay, and that stuff, feeding stuff, will come to the main center kitchen and give all this food and transport to the department. And by list, he will give the dish to the patient. Okay? Maybe if the patient regime, do you remember how many regimes we have?
Four regimes.
Which for the fleet? How many regimes? 4 regimes. Which regimes? That regime? That regime? No. Ward regime and general regime. If patient in general regime, patient will feed in the kitchen. If patient in 3 another regimes, strict bed and ward regime, they will take their food in ward, in the bed, maybe in the bed, in ward, and with help of someone, maybe with help of And I want to tell about a little bit about manipulation, injections. After doing injections, reddish of injections of all materials. What happened with them? What happened? They transferred.
Disposal according to biodegradable, non-biodegradable, put into different disposal.
Yes.
And then they are disposed of.
What happened with them? At the end, what happened with disposal materials?
They are burned.
Sterilized, they burn. Nurse, what happened? Okay, and nurse will transport these disposal materials to the burn center.
But it's
Not sanitary, it's just burn. Okay? But surgical, for example, in therapeutic department, we don't have for sterilization materials. We don't have. For surgical department, yes, they have their instrument will sterilize, but we don't have instruments. Our instruments only stethoscope, BP meter, and that's it. And injection and syringe. No, what is it? Needle. No. Syringe are all burned after using, okay? Now it's all department here. You see, this is the neurology department, our neurology department for adults. And there is the radiology department. In the radiology department, we do X-ray, MRI, CT scan, ultrasound. They also present. Okay. This is a diagnostic center. Here is a audiometry. Audiometry here is done. On that side of this bill, we have a admission department. Hospital.
अनस अनस एक बार देखना इधर अनस
My department where I work, and this is internal medicine, internal disease department or cardiology department. Okay, fine.
डिपार्टमेंट को बोल रहा हूँ डिपार्टमेंट
Ultrasound of the heart. Heart ultrasound is the ECG.
ECG.
Not ECG. Eco. It's a ultrasound. Eco cardiography. Understand? This is our pay attention come. It's our kitchen for feeding. But you can ask why they're preparing food for staff members. For staff members, yes. Because central kitchen will prepare only for patients, not for staff. And we are making, we are buying ourselves and make here for staff. Okay? And here patient.
Sorry, my 4 students.
Washrooms. Bathroom, 1 bathroom and 2 washrooms. And if you remember, should be space for stretcher. Here is the cabinet of students. Okay, rooms, education rooms. She is doctor of the department. Okay. All of these.
Patient.
This one is lecture hall for students. You know that it's clinic.
Lecture hall.
In 4 semesters, when you come, you will have lecture in this cabinet, okay? Propedeutics. And
Staff members in the department. Reception.
okay.
அது இருக்குங்க.
I want to say about this part. Right. Our nurse. Here is nursing post. Nursing post. What is the function of this nursing post? Here is the placement of the nurse in duty. Nurse in duty. She will stay here and come here. I want to show you in this part. In this
அல்றா அப்படி இல்ல.
Here, many documents is storage of many documents. Which document? What is it? History. Patient's history. Patient's history. During the duty, all histories are taken here, and nurse in duty will check them one by one. And here, list of prescription. She finds list of prescription. She will do all injections by this prescription, okay? And manipulation and something, another thing. And pay attention in this side, many journals. Documentation is the main part of the, how many, which nurse, which duty staff name, then how many patients totally, how many new patients, how many outpatients, and they will write it every day. It's one journal. Another journal here. Stuff. Stuff. Okay. And many another journals. Okay. All journals here. And here about patient information. It's only for doctors. Patient cannot see. Only for doctors of Uzbekistan. Maybe say a patient want to make surgery in Tashkent, for example, yes? He go to Tashkent doctor open this, find the name of the patient, and all information, medical information is written here. Understand? By day, by timing, every analysis, each drugs, each medication, which I prescribe, maybe all during the whole life. Understand? It's information, medical information of the patient all over Uzbekistan. Now it's all over Uzbekistan. Okay. Understand? This is nursing post. Okay?
அந்த அம்மா போயிட்டு இருந்தாங்க.
Stay here, you stay here. This
इंजेक्शन रूम है ये.
Water regime, in bed, in sleep regime, will take the injection in water. Next, analysis, blood analysis. Understand? And this cabinet, not all cabinet can be injection room. In injection room should be some rules. Which rules? Pay attention, it's walls covered. Walls and floor covered for best clinic. Because here can spread first aid. Understand? Each medical institution each medical cabinet should consist of these first aid for burning. Burning of needles.
Needle burner.
Understand? For washing hands, because nurse per day should wash her hands by special rules. First, yes, you see, each part should be cleaned. Understand? Like this, and this area. Yes. If we do this first, we can clean totally our hands. Understand? Okay, done. Let's go. This cabinet is clear. This cabinet. Okay, now another type. Senior is line. This, yes. Not, she's not. She's sitting there, but not she. It also should be compulsory initially found. Why? For pillows, blankets, and so on. Okay? And here, this room of senior nurse cabinet. Now come and see what here is done. In senior nurse cabinet, main function, one of the main function of this cabinet, storaging of senior nurse will, by prescription, will give it to the patients. Understand? Now change.
வார்டு இதுதான் வார்டு உஸ்பெகிஸ்தான் ஹாஸ்பிட்டலில்